Can your smartphone play an important role in helping to reduce the spread of COVID-19? Well, the state of Virginia thinks that it can, and they have a new app they're offering and encouraging people to use. Let's understand more about how all of that works. I'm Lee Kelso. This is HealthCall Live Online, with extended versions of interviews heard in our regular radio broadcast, the HealthCall Live Radio Hour. So the state of Virginia now is promoting use of a free app they say protects your privacy while at the same time giving you advance notice that you may have been exposed to COVID-19. Let's figure out how all that works by talking with Jeff Stover. He is the executive assistant to the commissioner of the state of Virginia's Department of Health. Jeff, thanks for joining us today.
Hi, my pleasure. Nice to be here.
Yeah, I'm glad you're here. So let's start with some of the basics. I know people are really freaked out about privacy. What is there about your app that protects my privacy?
Sure. So it's a great question. It's one that we should be asking. And that's why we in Virginia, as we instituted an app to help with exposure notification, that we jumped on board with what Google and Apple had put together as a framework. So our app is based on that skeleton that is the Google Apple exposure notification framework. And it works exclusively from an anonymous perspective. In fact, you can't even put an app on top of the skeleton if you're attempting to collect anything related to personally identifiable information or location data.
So we have covered this topic before on the program, so let me catch people up, and if I make a mistake, please correct me. But the way this works is Apple and Google have built into the new software on their telephones the ability to track the Bluetooth signal of phones that are nearby. So if you are within 6 feet of someone for 15 minutes or more, the software captures an anonymous identification code. And then if later that person is deemed to be positive, that person receives a PIN code. They upload the data to a server, and then the server notifies you that you have been exposed. Did I get that correct?
That's mostly correct. Yeah. I think the big difference there is that the Bluetooth signals that are being captured, or those chirps that are going out from each of the devices that actually have the app, you're capturing all of those chirps of people that are around you, whether or not it lasted for 15 minutes or if you were within 6 feet. Those Bluetooth signals and the data collected from it is what determines, once there's been a potential exposure, that determines the proximity and the length of time and whether you get an exposure notification.
Got it. I didn't understand that. So it's grabbing everything and then after the fact determining was your contact within the exposure window of 6 feet and 15 minutes.
Correct.
Okay, good to know. Glad you straightened that out. How many users do you have in the system right now?
So as of yesterday, we were just under 750,000. I'm sure we crossed over that 750,000 threshold today. So we're very excited about that. We've continued to increase every day since we launched on the 5th of August. So I'd say on average, we have 2,000 to 5,000 new downloads every day.
And tell me about the effectiveness so far. Are you seeing notifications go out?
Yeah, on average, there's about 116 notifications that get sent on a daily basis. So 116 times a day. There is a likely exposure notification to someone that is informing them that they have been within 6 feet for at least 15 minutes to someone who is not anonymously reported as positive. There's more than that because there's all the matches that occurred that didn't meet that criteria. So those never result in an exposure notification. So there's a lot of those types of interactions that are going on in the background that the system never sends out.
So I'm a little concerned about the fact that a hole in this system appears to be you send a notification, but you don't know who you're sending it to, and you don't know whether or not they got tested or went into quarantine, right?
So I wouldn't say it's a hole. I would say that the person that you were standing behind line in at Walmart, let's just say, whom you don't know, could have been someone who tomorrow tests positive, or perhaps you do. So the fact that you don't know that individual, but you can send an anonymous positive report via your phone through COVIDWISE. If that person has COVIDWISE, they at least can get a notification that, hey, I was near someone that had this positive diagnosis. So therefore, I have the ability then to get tested if I feel like I should, to keep an eye on my symptoms, to maybe change my behaviors at home while I'm assessing my symptoms, because perhaps I've got an elderly, family member who's immunocompromised living in my house, right? So all those kinds of things are benefits that someone can follow, even though they didn't know the person who had submitted that notification.
So is there any interaction at all with contact tracing? So I think that's an important distinction to make. This is exposure notification, not contact tracing. So how do they two tie in any way at all?
Yeah, so that's a huge point. I think they are separate entities. They're closely tied to one another, but they're not the same thing. So manual contact tracing is all about knowing who you are, where you are, how to get in touch with you, right? Exposure notification has none of that. So what we do in Virginia, and I think most states are operating in a similar fashion, when a positive diagnosis for COVID comes into the public health department, then there's a case investigator who is making that initial call to that patient. And once they get in touch with them, usually within 24 hours, you have that general conversation, ensuring that they know about their diagnosis. Are there things that we can help with from a prevention standpoint, et cetera? Part of that conversation includes the questions of, do you have COVIDWISE downloaded on your phone by any chance? And if the answer is yes, then we will provide them that 6-digit PIN number you referenced earlier. So it's a unique PIN that only goes to that individual. And then that person has the freedom to put that into COVIDWISE at their will when they want to. And if they so do, then that's what triggers that anonymous positive result through the app system that may trigger other people to get an exposure notification.
So what do I see on my phone? What is it telling me?
So if you have the app on your phone and you go to, at the bottom of the app, there'll be a little icon that says notify others. And you can click on that and it will pull up a screen system where you will have then a 6-digit PIN. You have a 6-digit number to put into that system. And that's what the folks at the Department of Health have given you. So you put that into that system, and it's just the way for the COVIDWISE app to verify that that's a validated positive result. So in other words, a rogue individual, John Doe, just can't go in and put 10, 15, 20 positive results in the system because they're having a fun time with their friends and thinking it's cute. Right? You need to know as a user that if you receive an exposure notification, that it was a legitimate exposure notification that came from someone who the health department validated was positive. And that's the key point there.
And I assume that notification says you may have been exposed. Here's what to do. What are you urging me to do?
Yeah. So the push notification you would receive would basically tell you that you were likely exposed to someone who was diagnosed with COVID-19, and it would tell you approximately how many days ago. So that individual who put it in the system would say, give the approximate date of when their symptoms began, right? And then based on that, you would receive, because your phone knows from your Bluetooth signal match, right, that match occurred on XYZ day. So that push notification would tell you that the likely exposure notification occurred, perhaps 5 days ago, right? And then you then can go into your app, and we have a thing in there called the virtual VDH that kind of walks you through some steps. So you could go to something that says, oh, I just received an exposure notification, and click on that. And it might tell you, hey, you might want to go here to this particular website and check out our symptom checker, right? You may want to go here to this URL and see where testing sites are currently happening in Virginia or in your area, right? So all those types of things, you may want to contact your healthcare provider, right? Those types of things are available to you then kind of quick and easy on the app itself.
And does it notify me even if that contact was 6 weeks ago, or is there a time frame? So I'm only going to get notified if I'm within that 2-week time period.
Yeah, it would have only occurred within that past 14-day time frame.
Okay. So it's
So
it's
yeah, you
programmed to
wouldn't receive
minimize
anything
false
prior to that.
negatives. Yeah,
That's
got it.
correct.
Okay, got it. What So I can load this app now, even though I live in the state of Indiana, but it's not going to do me any good, right? Tell me how that works and what plans there may be in order to make this nationwide.
Yeah. So the use of these kinds of apps is being done on a localized level or a state level or Washington, D.C., for example, jurisdiction. So we were the first state to launch back in early August. So we have our own key server here in Virginia. That means when you upload a positive result anonymously, those Bluetooth keys go to a server in Virginia, and that's where they reside. So everyone else in Virginia who has COVIDWISE, their devices are checking that server twice a day and looking for matches, right? If it finds matches based on those Bluetooth keys, it then looks to see what those matches entail. Was it within 6 feet? Did it last for at least 15 minutes, et cetera? So that was Virginia specific. Since we launched, there's been a new server put in place called the National Key Server. And it is actually being hosted by the Association of Public Health Laboratories, APHL. And I believe most other states, including DC, I believe, are using that National Key Server because it's been stood up since it was there before they launched their apps or their systems. So the benefit of that is that if two different states are using the same key server, then all of the people who submit a positive result, all of those Bluetooth keys are going to that same server. So regardless whether I'm in Virginia or I'm in Washington, D.C., positive results are hitting the same place. And the process of determining whether you were likely exposed is being shared. So Virginia is actually switching over to that. It's just been a process for us to actually have to take those additional steps. So by mid-November or so, we anticipate being switched over to that national server.
So the state of Indiana then would have to join the program and would have to have the ability to generate a PIN number that would associate with the national server, and then your app would work here, right?
Yes, but no. So in Indiana, you would need to have an app or a process that works for Indiana, because the only way that you in Indiana could make full use of COVIDWISE is if your positive result for a diagnosed, COVID positive result was going to the Virginia Department of Health, right? And then we validate that, because you can't submit anything to that app as a validated positive person unless the health department has contacted you. So obviously Virginia only receives results from Virginians.
Right.
So Indiana would need to do the same thing. And any kind of app that they stood up in the state of Indiana would then work in close concert with things like COVIDWISE or any other state app if they're all using that national key server.
So is the app that you built, or I'm sure it was built for you by a contractor, can Indiana just buy that app and deploy? I mean, we don't have to start from scratch, right?
You certainly don't have to start from scratch. You absolutely could go to any of the developers that have built apps in any of the states. They're all going to have state-specific information in there, but absolutely, you don't have to recreate the wheel. And then there's also an express version of this that has come out more recently. So Apple and Google went kind of into their phase 2, and that express version for iPhones means that, you can, the state of Indiana, for example, could create a configuration file that gets built into the operating systems of an iPhone for all the users in Indiana, right? So that's not an app per se. You'd still have to have an app for Google, but Google's actually going to work with those kind of states who want to do that to build an app independently, right? So it's following a standardized process. You just plug in the information that you want, and there it is. We don't need to do that in Virginia because we're already stood up with an app. But we will be doing the express version with Apple.
So I'm reading that 20 states are now in the process of deploying these apps. So it seems like the idea is catching on. What have you learned that you didn't expect? Any surprises so far?
Yeah, so it's a good question. I think, I don't know if this is not to be expected, but I would say that, it's been it's been interesting, the process of marketing such an app. You would like to think that you could simply tell people what it is, and people would accept that for what it's worth, but that's not the environment that we live in. So the level of misinformation, continues to exist. I would say that we've had to work pretty hard at misinformation, and we continue to do that. We respond to people who put comments in the App Store or the Google Play Store and in various social media outlets. We're reviewing them on a regular basis, and we respond back to people. We correct things that are blatantly wrong. We point people to the right information, et cetera. And, that's time consuming, but I would say it's also been very worthwhile. I think the level of misinformation has gone down over time. So that's good. And I would say we've been pleasantly surprised at the continued increase in downloads that have happened since we launched on the 5th of August. I mentioned earlier, we've had every day we have more downloads. We've never had a day we did not. And I think the general public has welcomed COVIDWISE. We had comments early on from folks who stated, when Virginia came out, we were the first in the country to do this, that people were proud, right? Virginians were proud to say, this is something that we are really happy that we're first in the nation doing. And people have embraced it in large part.
Well, that's great. Any final thing that you want us to know before we wrap things up?
I think the big picture here is that we have to keep this in the public's eye. We have blanketed the Commonwealth of Virginia with every marketing strategy that is available to us. And there are still lots of Virginians who have never heard of it, don't know what it is. And that stretches every gamut of the economic and racial sector. No one is immune to that. So there's a lot of work to ensure that people know what these things are and what they are not, and that we need to keep that moving forward. So folks like yourself who are doing this, this is what helps so that people understand what exposure notification is, and we're grateful for that.
Jeff Stover is the executive advisor to the Commissioner of Health for the State Department in Virginia. Jeff, thank you for your time today.
You're welcome. Thank you.